I've been a surgeon for 18 years now, and I've seen things that would keep most people awake at night. Emergency trauma cases that come in at 3 a.m. with injuries so severe you wonder how the person is still breathing. Complex operations that go on for 12 hours straight, where one wrong move could end someone's life. Cancer surgeries where you have to remove so much tissue that you're not sure the patient will ever be the same again. But there's one procedure that stands out from all the rest. One case that, even now, 5 years later, I still think about almost every single day. It haunts me in ways that the most gruesome trauma surgeries never have, and not for the reasons you might expect. It happened on a Tuesday night in October 2019. I was working at Presbyterian General, a large teaching hospital in downtown where I'd been on staff for about 8 years at that point. I was the attending surgeon on call for general surgery, which meant handling whatever came through the emergency department doors between 6 p.m. and 6 a.m. The call came in around 11:45 p.m. A 34-year-old woman had been brought in by ambulance after collapsing at home. Her name was Helena Michaels, and according to the paramedics, her husband had found her unconscious on their kitchen floor. She'd been complaining of severe abdominal pain for the past week, but had been putting off seeing a doctor because she didn't have insurance and couldn't afford the bills. When I first saw Helena in the emergency room, she was conscious, but clearly in agony. Her skin had a grayish pallor that immediately set off alarm bells in my head, and she was clutching her abdomen like she was trying to hold something inside. The ER physician, Dr. Marcus Delacroix, briefed me quickly on her vitals and symptoms. Her white blood cell count was through the roof, indicating a severe infection. Her blood pressure was dangerously low, and she had a fever of 103.2 degrees. The CT scan showed what appeared to be a large mass in her lower abdomen, surrounded by what looked like fluid or possibly infected tissue. It was hard to tell exactly what we were dealing with from the imaging alone, but whatever it was big, and it was causing her body to go into septic shock. Helena was married but had no children. Her husband, James, was in his late 30s, a construction worker who seemed completely overwhelmed by what was happening. He kept asking me if she was going to be okay, and I had to be honest with him that I wasn't sure until we could get in there and see what we were dealing with. The plan was straightforward: emergency exploratory surgery to identify the source of infection and remove whatever was causing it. These types of procedures are usually pretty routine, even when they're urgent. You go in, assess the situation, fix what's broken, clean out any infection, and close up. Most patients recover fully within a few weeks. We prepped Helena for surgery around 1:15 a.m. The anesthesiologist, Dr. Malcolm Hensley, got her under without any complications, and we moved her into operating room 3, which was the largest of our surgical suites. I had 2 residents with me that night: Dr. Ashley Mitchell, who was in her 4th year and very competent, and Dr. Brian Costa, a 3rd year who was still learning but eager to gain experience with emergency procedures. I also had 2 surgical nurses, Linda and Marie, both of whom I'd worked with countless times before. The team was solid, experienced, and I felt confident we could handle whatever we found once we opened her up. The initial incision was routine. We made a midline cut from just below her sternum down to her pubic bone, giving us maximum access to her abdominal cavity. The moment we opened her up, though, I knew this wasn't going to be a standard procedure. The smell hit us first. It wasn't the typical smell of infection, or even the metallic smell of blood. It was something else entirely. Sweet and cloying, almost floral, but with an underlying note of decay that made my stomach turn. I've smelled a lot of things in operating rooms over the years, but this was unlike anything I'd ever encountered. Dr. Mitchell looked at me over her mask, and I could see in her eyes that she was thinking the same thing I was. This smell wasn't normal, but we pressed on because Helena's life depended on us figuring out what was wrong and fixing it. As we began to explore her abdominal cavity, the first thing I noticed was the color of the fluid that was pooled inside. It should have been clear, or maybe slightly bloody if there was trauma, or yellowish if there was infection. Instead, it was this dark green color that seemed to shimmer slightly under the surgical lights. It looked almost oily, like it had a different consistency than normal body fluid. Dr. Costa asked if he should take a sample for the lab, and I nodded. We needed to know what we were dealing with. But when he tried to suction out some of the fluid, the suction machine made a strange noise, like it was struggling to pull the liquid through the tubes. The fluid was thicker than it should have been, almost syrupy. We continued exploring, carefully moving organs aside to get a better view of the mass that had shown up on the CT scan. What we found defied everything I thought I knew about human anatomy and pathology. The mass was located where Helena's appendix should have been, but it was easily 10 times larger than a normal appendix. It was roughly the size and shape of a football, and it was this same dark green color as the fluid. But the most disturbing thing about it was that it appeared to be moving. Not moving like a heartbeat or breathing, but actually writhing, like there was something alive inside it. The surface was smooth and slick, almost like it was covered in mucus, and as we watched, it would contract and expand in slow, rhythmic pulses. I've seen plenty of tumors, cysts, abscesses, and other abnormal growths in my career. But this thing didn't look like anything in any medical textbook I'd ever studied. It looked more like some kind of organ that shouldn't exist in the human body. Dr. Mitchell whispered, "What the hell is that?" And I had to admit, I had no idea. We all just stood there for a moment, staring at this impossible thing that was clearly killing our patient, but didn't seem to belong in the realm of known medical science. The mass was connected to Helena's intestinal tract by what looked like a thick cord or tube, almost like an umbilical cord, but much larger. This connection appeared to be how the mass was feeding off her body, drawing nutrients and blood supply from her normal organs. I could see that it had been growing for some time, probably months, slowly poisoning her system as it got larger. We needed to remove it, but I wasn't sure how. The connection to her intestines was extensive, and I was worried that cutting it away might damage her bowel beyond repair. But leaving it in place wasn't an option either. The infection it was causing would kill her within hours if we didn't act. I made the decision to start carefully dissecting around the mass, trying to understand its anatomy before making any major cuts. As I began working with my scalpel, something happened that still gives me chills when I think about it. The thing reacted to my touch. The moment my blade made contact with its surface, the entire mass contracted violently, almost like it was trying to pull away from me. The movement was so sudden and forceful that it actually shifted some of Helena's other organs, and her blood pressure dropped dramatically on the monitors. Dr. Hensley called out from behind the anesthesia screen that Helena was becoming unstable, but I couldn't stop now. We were committed to removing this thing, whatever it was. As I continued to cut, the mass began to leak more of that strange green fluid, but this time, the fluid seemed to be moving on its own, flowing upward against gravity and spreading across Helena's organs like it was exploring or searching for something. It left dark stains on everything it touched, and those stains seemed to pulse with the same rhythm as the mass itself. Dr. Costa, who had been assisting me, suddenly stepped back from the table. His face was pale above his mask, and he said, "Doctor, look at the monitors." I glanced up at the screens that displayed Helena's vital signs, and what I saw made no sense. Her heart rate was steady at 72 beats per minute, which was normal for someone under anesthesia. Her blood oxygen levels were fine. Her blood pressure had stabilized. According to every measure we had, she was doing well. But she was clearly dying. I could see it in the color of her organs, in the way her tissue responded when I touched it, in the overall appearance of her body's systems. Everything looked wrong. Diseased, like her body was shutting down at a cellular level. Yet the machines said she was stable. That's when Dr. Mitchell pointed to something that made my blood run cold. The dark green stains that the fluid had left on Helena's organs weren't just sitting there anymore. They were spreading, growing larger, and they appeared to be forming patterns. Not random patterns like you'd expect from spilled liquid, but deliberate geometric designs that looked almost like writing in some unknown language. I forced myself to focus on the surgery. Whatever was happening here, Helena needed that mass removed or she was going to die. I continued cutting, working to separate the thing from her intestinal tract. The process was incredibly difficult because the mass seemed to anticipate my movements, contracting and shifting just before my scalpel would reach its target. It took nearly an hour to fully detach it from her body, and when I finally lifted it free, I was shocked by its weight. Something that size should have weighed maybe 2 or 3 pounds, but this felt more like 15 or 20 pounds, far heavier than it should have been given its apparent composition. We placed it in a specimen container, but the container wasn't large enough. The mass actually deformed slightly to fit inside, like it was made of some flexible material rather than solid tissue. Once it was contained, it continued to pulse and move, though more slowly than when it had been inside Helena's body. The strangest part was what happened next. The moment we removed the mass from her body, all of those dark stains on her organs began to fade. Not gradually, but rapidly, like someone was washing them away with an invisible solvent. Within minutes, Helena's abdominal cavity looked completely normal and healthy. Her vital signs, which had been contradicting what I was seeing visually, suddenly made sense again. Her organs regained their normal color and texture, and when I tested the blood flow to various areas, everything appeared to be functioning perfectly. We cleaned out her abdominal cavity, checked for any remaining abnormalities, and closed her up. The entire procedure had taken just over 3 hours, but it felt like we'd been in there for days. As we were finishing, Dr. Costa asked what we should do with the specimen. Normally, anything we remove during surgery goes straight to pathology for analysis, but this thing was still moving inside its container, and I wasn't sure the pathology lab would know what to make of it. I decided to keep it in the surgical suite for the night and figure out the next steps in the morning. We put the container in a locked cabinet and cleaned up the operating room. But when we were done, I noticed that the room still had that strange, sweet smell, even though we'd thoroughly cleaned every surface and changed out all the linens. Helena's recovery was nothing short of miraculous. When she woke up from anesthesia around 6 a.m., she said she felt better than she had in months. Her pain was completely gone, her fever had broken, and her color had returned to normal. By that afternoon, she was sitting up in bed eating solid food and joking with the nurses. Her husband James was overjoyed, of course, but he kept asking me what we'd found inside her. I wasn't sure how to explain it. How do you tell someone that you removed something from their wife's body that defied medical explanation? I ended up giving him the standard explanation that we'd found and removed an infected mass and that she should make a full recovery. But I couldn't stop thinking about that specimen in the locked cabinet. The next morning, I went back to the surgical suite to check on it, and what I found disturbed me even more than the surgery itself had. The container was empty. Not broken, not opened, just empty. There was no sign of the mass anywhere in the cabinet or the room. It was like it had simply vanished overnight. I questioned everyone who had access to that room. The night cleaning crew said they hadn't touched the cabinet. The other surgeons on call said they hadn't been in OR 3. Security reviewed the camera footage and confirmed that no one had entered the room between the time we left and when I returned the next morning. I reported the missing specimen to hospital administration, but without being able to explain what it actually was, I couldn't make them understand why its disappearance was so concerning. They assumed it had been mislabeled and sent to pathology by mistake, or that one of the residents had moved it somewhere and forgotten about it. Dr. Mitchell and Dr. Costa both confirmed what we'd seen during the surgery, but when I suggested we should try to figure out what that thing had been, they both seemed reluctant to discuss it. Dr. Costa actually transferred to a different hospital about a month later, and when I asked him why, he said he needed a change of pace. Helena made a complete recovery and was discharged 3 days after surgery. Her follow-up appointments showed no signs of infection or complications, and her blood work returned to completely normal levels within a week. It was like whatever had been wrong with her had never existed at all. But I couldn't let it go. I spent months researching medical literature, looking for anything that might explain what we'd encountered. I searched through case studies, rare disease databases, and even reached out to colleagues at other hospitals to see if anyone had seen anything similar. I found nothing even close. The closest thing I could find were some old medical texts from the 1800s that mentioned parasitic masses with unusual characteristics. But these were written before modern diagnostic techniques existed, so the descriptions were vague and unscientific. There were also a few case reports from various countries describing surgical removal of unknown biological matter from patients' abdominal cavities. But these were scattered across different decades and different continents, with no apparent connection to each other. About 6 months after Helena's surgery, I was contacted by a researcher from the CDC who said he was investigating unusual medical cases. He'd somehow heard about Helena's procedure and wanted to know if I'd be willing to discuss it with him. I agreed to meet with him, thinking that maybe someone in the government was tracking these types of anomalies. The researcher, who introduced himself only as Dr. Lawrence, was very interested in the details of what we'd found and removed. He took extensive notes and asked very specific questions about the mass's appearance, behavior, and the way it had connected to Helena's body. When I told him about the specimen disappearing, he didn't seem surprised. He said this was not uncommon with cases like Helena's, though he wouldn't elaborate on what he meant by cases like Helena's or how many similar cases there might have been. He gave me his card and asked me to contact him immediately if I ever encountered anything similar in the future. When I looked at the card later, it had a phone number but no address, and when I tried researching Dr. Lawrence with the CDC, I couldn't find any record of anyone by that name working there. I tried calling the number a few times over the following months, but it was always disconnected. That was 5 years ago, and I haven't performed any procedures since then that were remotely similar to Helena's surgery. But I think about it constantly. I dream about that mass, about the way it moved and reacted to my touch, about the strange fluid and the patterns it formed on Helena's organs. Most of all, I think about where it went. What happened to it after it disappeared from that locked cabinet? Was it somehow still alive when we removed it from Helena's body? And if so, what was it doing during those hours it was contained in our surgical suite? I've also wondered about Helena herself. Her recovery was so complete and rapid that it almost seemed supernatural. I've seen patients bounce back quickly from serious infections before, but never like that. It was like whatever that thing was, once it was gone, her body immediately returned to a state of perfect health. What troubles me even more is something I discovered about 3 months after her surgery. I was reviewing her preoperative blood work when I noticed something I'd missed in the rush to get her into the operating room that night. Her blood type was listed as O negative on her chart, which is what we'd used for any transfusions during the procedure. But when I pulled her earlier medical records from a routine physical she'd had 2 years prior, her blood type was documented as A positive. Blood types don't change. It's genetically impossible. I assumed there had been a clerical error somewhere, but when I had the lab retest samples from both dates, the results were consistent with what was documented. Somehow, Helena's blood type had actually changed in the time between her last physical and her emergency surgery. I brought this to the attention of our hospital's hematology department, but they dismissed it as a documentation error and refused to investigate further. They said the earlier test must have been mislabeled or contaminated, despite the fact that I'd personally witnessed both blood draws and seen the lab processes that confirmed the results. I still see Helena occasionally for routine follow-ups, and she seems genuinely happy and healthy. She never asks about what we found during her surgery, and I've never volunteered the information. But sometimes when I'm examining her, I notice she has a small scar on her abdomen that wasn't there when we closed her up. It's perfectly circular, about the size of a dime, and it's located exactly where that mass had been connected to her intestinal tract. When I asked her about it once, she said she'd never noticed it before and had no idea where it came from. But I've seen that same scar in medical photographs from some of the old case reports I found during my research. Different patients, different decades, different countries, but the exact same scar. More disturbing is something her husband James mentioned during one of these follow-up visits. He said that Helena had been having vivid dreams since the surgery, not nightmares exactly, but dreams where she felt like she was in 2 places at once. She'd dream that she was lying in bed next to him, but also simultaneously standing in a dark room somewhere else, surrounded by other people she'd never seen before, but somehow recognized. She'd wake up from these dreams with detailed memories of conversations she'd had with these strangers, conversations about places and events that had never happened in her real life. James said she'd started keeping a journal of these dreams, filling pages with descriptions of people and locations that seemed completely foreign to her waking mind, but felt familiar in the dreams. When I asked Helena about this directly, she became uncomfortable and changed the subject quickly. But I could see in her eyes that James wasn't exaggerating. Whatever she was experiencing in those dreams was real to her, and it was something that had started only after we removed that mass from her body. I don't perform night surgeries anymore if I can avoid it. I've requested to be taken off the emergency call rotation, and I stick to scheduled procedures during regular daytime hours. My colleagues think I'm getting soft in my old age, but the truth is that I'm terrified of encountering something like that mass again. Because I have the feeling that whatever it wasn't unique to Helena. I think there are others out there, other people walking around with these things growing inside them, slowly poisoning their bodies until someone like me has to cut them out. And I think whatever happened to that specimen, wherever it went when it disappeared from our locked cabinet, it's still out there somewhere. Still alive, still looking for a way back into a human host. The worst part is that I don't think Helena's case was random. I think she was chosen, selected somehow by whatever intelligence was behind that mass. And if I'm right, then removing it might not have saved her life at all. It might have just made room for something worse.